Hello everyone, and how was physiology today? A lot of reactions have already started pouring in, and a lot of my dear friends have told me that physiology was moderately tough and lots of graphs. The name graph should not really scare you. It is something which you normally cover in your theory. So let's go through the questions and let's see what are these graphs and what were the kind of questions which were asked. Now, of course, please, this is the first recall. The options may be different. Recall varies from student to student, so there is going to be differences in the options, but this is what I have received. So let's look at the first question. This says, regarding the cardiac action potential, which of the following is correct? Now, the cardiac action potential, this is recorded from all cells of the heart with the exception of the SA node and the AV node. And this is known as the plateau potential. And plateau potential has got 5 phases. There is phase 0, phase 1, phase 2, phase 3, and phase 4. What is phase 0? The phase 0 is the depolarization phase, and this is because of the opening of voltage-gated sodium channels, and this is because of a sodium influx. Phase 1 is the repolarization. This is also known as the early repolarization phase, and this is because of closure of sodium. So a decrease in the sodium influx. Phase 2 is what is known as the plateau phase. In the plateau phase, there is now opening of what are known as slow calcium channels, or also known as slow sodium calcium channels. So there is a calcium influx through these channels, plus there is also a potassium efflux because of opening of slow potassium channels. So in phase 2, in the plateau phase, there is gain of positive charge and there is loss of positive charge. And because there is gain and loss of positive charge happening simultaneously, you get a horizontal line, which indicates that there is no change in potential or minimal change in potential during this phase. Now, at this red arrow, the calcium channels close, and then we have the phase 3, which is the late repolarization phase, and this is because of a potassium efflux. Phase 4 is because of a slow closure of the potassium channels. Now, the options which I have received, or which some of you have told me. Now, it said slope of phase 1. What is the slope of phase 1? What is phase 1? Phase 1 was the early repolarization. What is responsible for the early repolarization? Closure of the fast voltage-gated sodium channels. So slope of phase 1 is due to opening of sodium channels? No, opening of sodium channels is responsible for phase 0. Slope of phase 1 is due to closure of sodium channels. That appears to be a correct answer. Slope of phase 3. Phase 3 is the late repolarization, which is because of a opening of the potassium channels. So this option is also incorrect. Slope of phase 3 is due to closure of calcium channels. No, this is because of the potassium efflux. The opening of potassium channels was responsible for the plateau phase. So the correct answer here, closure of the sodium channels, the fast voltage-gated sodium channels. Let's have a look at the next question. Now, this is spirometry. And now in this, you had to identify what is this volume which is indicated by the red arrow. Is it the FRC? What is FRC? It is the volume of air present in the lungs at the end of a normal expiration. Now, this is the tidal volume. Volume of air inspired or expired during a normal quiet respiration. And the volume of air which remains in the lungs at the end of a normal expiration is known as functional residual capacity. It is the sum total of ERV plus RV. So this is not my answer. Is it the ERV? Yes. What is ERV? Expiratory reserve volume. This is the volume of air expired forcefully over and above a tidal expiration. And what remains in the lungs once you've expired forcefully? Residual volume. And the sum total of ERV and RV is FRC. So answer to this question, you were asked to identify what is marked by the red arrow. This is ERV. What is FVC? Volume of air expired forcefully after a forceful inspiration. This is your forced vital capacity. This is IRV plus tidal volume plus ERV. So answer to this question is ERV. And most of you seem to have got it correct. Let's see another graph which was given to you, and this was the action potential. Apparently, there were two questions on the action potential. The options and the recall that I have got has probably become a little, the options of the two questions have got mixed. So nevertheless, I will describe all the phases. Let's see what are the possible options, and then you can think whether you marked it correct. Now, this is the action potential. The resting membrane potential of most neurons is minus 70 millivolts. When you give a stimulus, there is opening of voltage-gated sodium channels. Opening of voltage-gated sodium channels means there is influx of sodium. Cell will gain positive charge. Potential of the cell now moves from more negative to less negative value. It goes to the threshold level, which is usually minus 55 millivolts. Once it reaches the threshold potential of minus 55, now the opening of sodium channels is by a positive feedback mechanism. There is a sudden influx of sodium, which is responsible for the depolarization phase. Then the repolarization phase, which is because of closure of the sodium channel and opening of the slow potassium channels. In the repolarization phase, there is a decrease in sodium influx and an increase in the potassium efflux. There are two more phases. There is something known as the after depolarization phase. Now, this after depolarization phase, what do we see over here? There is a slight decrease in the rate of potassium efflux. And that is why there is a slight slope here, a decrease in slope in the after depolarization phase. During this phase, there is a slight decrease in the rate of potassium efflux. Then where you have point E, this is the hyperpolarization phase, which is due to a slow closure of the potassium channels. Potassium channels are slow to open, slow to close, and since there is a slow closure, so there is more potassium efflux. Potassium continues to move out of the cell, and in the hyperpolarization phase, the potential is 1 to 2 millivolts more negative than the resting membrane potential. It is at minus 71 to minus 72 millivolts. Now, this says point A to point C is due to opening of slow sodium channels. Point A to point C is the depolarization phase. This is due to opening of the fast sodium channels. Point C to point D is the repolarization phase, which is due to closure of sodium and opening of slow potassium channels. So this rules out options A and B. Point E is the hyperpolarization phase. What is this due to? This is due to slow closure of sodium channels. No, this is due to slow closure of the potassium channels. Point A to point D is the refractory period. This appears to be the correct answer. So refractory period. What is refractory period? A refractory period is the duration during which a cell does not respond to a second stimulus. It is divided into two. There is an absolute and there is a relative refractory period. Now, older knowledge was that the absolute refractory period includes the depolarization and the repolarization phases, and the relative refractory period includes the hyperpolarization phase, But today we know that the absolute refractory period is from the filing level till the repolarization is 1 1/3 complete. This is called the absolute refractory period. So during the absolute refractory period, if I give another stimulus, I will not get another action potential. And this is irrespective of the strength of stimulus. Then there is a relative refractory period. Relative refractory period is from repolarization 1/3 complete till the start of the after depolarization phase. That is called the relative refractory period. In the relative refractory period, if I increase the strength of stimulus, I will get another action potential. So what happens in the after depolarization phase? Now, after depolarization phase is no longer included in the refractory period. In the after depolarization phase, if the excitability in fact is slightly more than at resting membrane potential, in the hyperpolarization phase, the excitability is slightly less than at resting membrane potential. So point A to point D becomes the refractory period. So this appears to be the correct answer. But like I said, there were 2 questions on the action potential, so I'm not too sure about what was asked. And after having this brief discussion on action potential, I think both the questions should be solvable, right? Okay. Next, a newborn with respiratory distress syndrome has deficiency of surfactant. Surfactant secreted by the type 2 pneumocytes. Which of the following is seen in this patient? Increased surface tension, decreased compliance, decreased surface tension, increased compliance, both decreased, both increased. Now, this is a rather simple question. What is the role of surfactant? Surfactant will reduce the surface tension. And what is the relationship between surface tension and compliance? Compliance is inverse to the surface tension. More the surface tension, less the compliance. Less the surface tension, more the compliance. So if there is a deficiency of surfactant, there will be an increased surface tension and a decreased compliance. What is compliance? Compliance is nothing but delta V by delta P. Change in volume per unit change in the transpulmonary pressure. This should have been relatively easy. Let's have a look at the next question. Now, this was again, there was a clinical situation, but a core physiology concept was asked. And this says a 40-year-old male presents with a history of trauma, hemoglobinuria, undergoes a series of lab investigations. His potassium is on the higher side. Normal potassium levels 3.5 to 5 millimoles of 3.5 to 5 milliequivalents per liter. For univalent ions, millimoles and milliequivalents is the same. What is the effect on peripheral neurons? So normally, potassium inside the cell is, let's say, 140 millimoles per liter or milliequivalents per liter. Outside the cell, 3.5 to 5 millimoles per liter. And a cell membrane at rest is almost freely permeable to potassium. When I say a cell membrane at rest is almost freely permeable to potassium, it basically means that there are leak channels for potassium which are open at rest. And when a channel is open, that particular ion moves from higher to lower concentration. So potassium tends to move from inside to out. Loss of positive charge creates a negative potential inside the cell. So resting membrane potential is negative inside the cell with respect to outside. And how much is that? Usually minus 70 millivolts for most neurons. Now, if the ECF potassium increases, hyperkalemia, ECF potassium increases, there is a hyperkalemia. So what will happen to the concentration gradient for potassium between the inside to outside the cell? Decreases. A decrease in the concentration gradient. So if there is an increase in the ECF potassium, this decreases the concentration gradient for potassium. A decrease in concentration gradient for potassium means there is now a decreased tendency for potassium to leave the cell. Decreased tendency of potassium to leave the cell. So there is a decrease in the diffusion potential of potassium. So if there is decreased tendency of potassium to leave the cell, more positive charges inside the cell. So if there is more potassium inside the cell, so what will happen to the resting membrane potential? Resting membrane potential will tend to become less negative. So the RMP, instead of minus 70 millivolts, now because of less movement of potassium from inside to out, the RMP will be less negative. So this is either minus 65 or minus 60 millivolts. So that means the cell will be depolarized at rest. The resting membrane potential is less negative. A less negative resting membrane potential means what will happen to the excitability of the cells? There is an increased excitability. And increased excitability of the cell means you can correlate it clinically. Mild to moderate hyperkalemia is usually associated with cardiac arrhythmias because the cells are depolarized, increased excitability, arrhythmias. So answer to this question, now this is a mild hyperkalemia and the resting membrane potential will become less negative. Let's look at this question. Now again, two versions of this question. So let me see how many of you feel that this was the question which was asked. A second version is that this was asked. Now there's a difference between the two. So let me try and answer that. Now this is trying to ask you, what is happening to these different substances along the length of the nephron and towards the end, which I don't know if you can see this, what happens in the urine. Yes. So if you look at what is there? So whenever you have a graphical question, whenever there is a graph, I always tell you that please see what is on the x-axis and what is on the y-axis. The y-axis here has got percent filtered load remaining and 100% is here, right? So that means for substances A and B, whatever was filtered, if filtered load was 100%, now, as it moves to the nephron, the filtered load is decreasing. In other words, they are being reabsorbed. But if you look at D, here, along the nephron, the concentration of the substance is in fact increasing. So, along with filtration, this substance is probably is being secreted as well. Have you got my point? Right? So, if this is my Bowman's capsule, afferent arteriole, glomerular capillaries, efferent arteriole, which will form the peritubular capillaries. So if a substance is freely filtered, yes, if it is reabsorbed, then the filtered load of the substance along the nephron will reduce. But if the substance is secreted, that means from the blood it re-enters the nephron, there will be increase in the concentration of the substance in the nephron. So A and B are reabsorbed and D is secreted. What is C? C is a substance whose filtered load remains constant. Whatever was filtered is the amount of that substance remains constant. Right? There is no reabsorption, no secretion of that substance, and that is inulin. So C is inulin. A and B are reabsorbed. If you look at A is reabsorbed to such an extent that it touches the baseline. It's 0 in the urine. And most of that reabsorption is taking place in the PCT. So A is glucose. Look at B. B is a substance which is being reabsorbed. Majority of it is being reabsorbed in the PCT, then in the distal tubule, and finally, hardly anything, almost 100% is being reabsorbed. And this is bicarbonate. Bicarbonate is freely filtered and completely reabsorbed if bicarbonate levels are normal. Most of the reabsorption of bicarbonate takes place in the PCT, but also in the distal tubule. What is D? Now, D is increasing in the nephron. This is being secreted. So this is para-aminohippuric acid. Para-aminohippuric acid is freely filtered and completely secreted. And the secretion takes place in the PCT. So according to this, A is glucose, B is bicarbonate, C is inulin, and D is para-aminohippuric acid. So some of you have said this was the question which was asked and this was the image. But some of you have also said that the question was regarding clearance. So plasma concentration is on the x-axis and clearance on the y-axis. And you had to identify which are the substances. Yes, majority of you feel it was the previous question which was asked, but in case some of you think it was this question, inulin is a substance whose clearance is equal to GFR. And how much is normal GFR? 125 ml per minute. So C is inulin. Inulin is a substance freely filtered, not reabsorbed, not secreted, and its clearance is equal to the GFR. The rate at which inulin is cleared from the plasma is the rate at which it is being filtered. Substance D is reabsorbed. Below a certain plasma concentration, it is completely reabsorbed and clearance is 0. What is the formula for clearance? Clearance of any substance is UV by P. If urinary concentration of a substance is 0, clearance will be 0. So below what is known as the renal threshold, glucose is. What is renal threshold? Renal threshold is the plasma concentration beyond which glucose begins to appear in the urine. Below renal threshold, whatever glucose is filtered is going to be reabsorbed. So urinary glucose is 0. If urinary glucose is 0, clearance will be 0. But after the plasma concentration of glucose reaches renal threshold, it begins to appear in the urine. So clearance of glucose will increase. So D is the clearance of glucose. C was clearance of inulin. D is the clearance of glucose. All substances which are reabsorbed will have a clearance which is lower than the clearance of inulin, and all substances which are secreted will have a clearance which is higher than the clearance of inulin. So B is the clearance of creatinine. Creatinine is a substance which is freely filtered and slightly secreted, so its clearance is slightly more than the clearance of inulin. In fact, for practical purposes, clearance of creatinine is also used for GFR estimation. A is the clearance of para-aminohippuric acid. Para-aminohippuric acid in low concentration is freely filtered and completely secreted. So very high clearance in low concentration. In high concentration, para-aminohippuric acid is incompletely secreted. So the clearance of para-aminohippuric acid decreases in high concentrations. In case this was the question, then A is the clearance of para-aminohippuric acid, B is the clearance of creatinine, C is the clearance of inulin, D is the clearance of glucose. There was one more question. Unfortunately, I've not been able to get the image for that question, and the recall is slightly vague about it. But I think what I was told is that there was the cell membrane which was shown. There was a protein which was shown inside this, in the cell membrane. Yes. And a substance binds with that protein. A substance binds with that protein. Then the protein undergoes a conformational change and the substance then moves into the cell. So if a substance is binding with the protein and then there is a conformational change in the protein and the substance is transported into the cell, that is an example of facilitated diffusion. So that the question has just been sent to me. So in case if this was there, then the answer to that question was facilitated diffusion. Yes, apparently the options were simple diffusion, facilitated diffusion, and something else, something else. So in that case, the answer is facilitated diffusion. So these were briefly the questions in physiology which have been asked in today's exam. Like I said, there may be errors, yes, in the recall of especially the options. And so I will need to probably correct those options. But yes, moderate level of the physiology questions. Do not get scared when you see a graph. Most of the times these graphs are covered in classes, but at the same time, always when you see a graph, look at the x-axis, look at the y-axis, and then interpret it. Never straight away look at the lines and try to answer the question. But first, always study a graph, look at the x-axis, look at the y-axis, and then accordingly answer the questions. So thank you very much, everyone, for your kind patience, and we'll be back soon with more. Thank you very much, and God bless.